Does an aspirin a day keep the doctor away?
Well, it could help or hurt you, so we'll find out.
When we were coming through, getting out of residency, it was routine to start all of our elderly patients on aspirin.
Yes, I was thinking back, we were talking about aspirin, I was thinking back and how many patients were on aspirin, and you're right, it was a lot.
We thought it would help prevent heart attacks and strokes.
Luckily, people have done studies and things have changed as far as recommendations go.
It's been a while.
It's been several years, maybe 5, 10 years, I don't know, but I still get patients coming in on aspirin for no apparent reason other than they want to prevent a heart attack.
All medicines, they have their benefits, that's why they're medicines, but they also have their risk. And even some of the over-the-counter medications, like we've discussed in other episodes before, have their risk. And aspirin, we use it as a blood thinner,
Right.
and that's good, but also has its downsides.
Yeah, well, in part because it's a blood thinner. A lot of heart attacks occur because you develop these platelet aggregations where they clump together, cause a blockage of the vessel, and that causes the heart attack. So the theory is let's inhibit the platelets, prevent the clots from even forming, and then we can prevent the heart attacks. Unfortunately, there are bleeding complications.
I think we see a lot of like internal bleeding, like diverticular bleeding,
How about stomach ulcers? You ever seen stomach ulcers cause bleeding?
ulcers, and again, aspirin magnifies that.
So we need to be careful with how we use aspirin and other blood thinners.
So which patients absolutely need to be taking their aspirin?
There's primary prevention and secondary prevention. Primary prevention means you've never had any heart attacks or strokes or anything like that, and so that would be primary prevention, and those are the ones we have to be careful with, because the secondary prevention, for people who've already had heart attacks and strokes, almost all of them will be on aspirin or some other similar type medicine.
Heart attack, the stroke, peripheral vascular disease, as long as they are at a high risk of bleeding, that this benefits them.
For this primary prevention group, those without heart disease, who is a candidate for aspirin?
So if you're in the category of folks between the age of 40 to 59 that are otherwise healthy, don't have heart attacks and strokes, as long as you don't have a high risk of bleeding and your cardiovascular risk is greater than 10%, so there's a whole calculation to figure that out, then you might benefit from aspirin.
And if you want to calculate your own risk, you can find these calculators online, and we'll link a place down below where you can do that. And it uses your age and your gender and your smoking status and cholesterol, blood pressure, so you will need some baseline numbers to go on.
It's not an automatic recommendation. Right. It's a personal decision that you have to make, because if there's a benefit, it's pretty small.
It is small.
And so for that class of older folks that we were used to prescribe for, these people that didn't have any heart attacks or strokes, but we thought they just needed to be on aspirin, this recommendation by the USPSTF says do not prescribe aspirin routinely for people over the age of 60 for primary prevention.
There's another group, the American Heart Association, along with the American College of Cardiology. They put that number just a little bit higher at 70 instead of 60. But either way, I mean, it's still something for primary prevention. If you're at high risk and younger, then it's worthwhile. But otherwise, it's probably not.
If you're 60 and above and you don't have any other problems, probably ought to avoid it.
People talk about doing this and taking just a baby aspirin every day. How many babies do you put on aspirin?
0.
Okay, yeah. So it's not really for babies. It's just a smaller dose, and that's why they call it a baby aspirin.
Aspirin.
Oh.
That's amazing.
Have you ever had baby aspirin?
Yeah.
Yeah.
The orange flavored.
Yes, I had that too when I was little. Back before we knew that we shouldn't give it really to kids, but I remember taking it as a child, and it was kind of orange flavored.
And if you take it occasionally for anti-inflammatory purposes or other reasons, that's not what we're talking about. We're talking about really that daily, everyday use to prevent heart attacks and strokes.
So people, you hear all the time, I think I'm having a heart attack, give them an aspirin. Should that be a baby aspirin?
No.
No, it's a higher dose.
325 milligrams. It's a regular aspirin.
The full regular aspirin.
Chew it.
Ooh, that doesn't sound very... Is it orange flavored?
I don't think so.
I don't think so either. It's bitter flavored. I've tasted that too. I don't know why, but I tasted that one time.
Better tasting than the next video that both did.
Oh, yeah.
So an aspirin a day may keep the doctor away if you're the right person.
If you're the right person.
And it may also take you to the emergency room with a gastrointestinal bleed if you're the wrong person. So be careful out there.
Yes.
If not aspirin, what are the primary prevention recommendations?
I think primary prevention of any cardiovascular disease usually revolves around lifestyle modification.
Don't let yourself get overweight. Don't smoke. Make sure your cholesterol's good. Avoid diabetes. Make sure that blood pressure is under good control.
Take good care of yourself. That's how you prevent heart disease.
We've been talking about aspirin. See if it made our list of the top things doctors bring on vacation here.